we ready? Good afternoon, everybody. I know it's difficult to hear, so I want everyone to get seated and get seated as close as possible if you're here to listen. Otherwise, we're competing with the giant crowd outside. So that's my first piece of advice. Sit down and sit down very close. Can you hear me well?
Yeah, they're here.
Okay, great. And I wanted then to start with a question to for the audience. Who in this audience has, put your hand up if you've heard of plasma therapy before. Put your hand up, don't be shy. It's just for me to understand how much I should talk about or what I should talk about. Wow, that's not a lot. So I'm kind of happy you guys are here. So you want to know a little bit more about plasma therapy, right? Right?
Yes.
Okay, perfect. This is then perfect. Gentlemen in the back, can you hear me? Okay, but you don't want to sit down? That's all right. Okay, so plasma, your blood is composed of three things in general: red blood cells, white blood cells, and plasma. This plasma has many, many, many proteins in it. These proteins feed our bodies, every cell in our body. And it is a way also of cleaning the byproducts of our metabolism. And they're probably the biggest indicator of health and disease. So whenever you go to the doctor, what's the first thing they ask you to do? Blood work. That tells them what's right and what's wrong. Now, I'm excited about this panel and why I'm moderating it. By the way, I'm on the, I should introduce myself. Adah Almutairi. I'm faculty at UC San Diego in pharmaceutical chemistry. I'm also one of the board of trustees of the FII, and I'm on the board of several private and public companies, both for-profit and not-for-profit. And I guest edited the impact report on AI and longevity that you've probably seen circulated around. Very happy that Dr. Oz was one of our contributors, and he spoke in the earlier panel. So I wanted to have this particular panel to champion plasma therapy and how it's really it's the secret to vitality, health and vitality. And I look at human longevity not in, as it says in the report, not in how long you live, but how well you live. And with that, I wanted to start really with Dr. Frank Cordasco, because the story of plasma and its benefits to our lives, I believe, started in orthopedics. Frank is a world-renowned orthopedic surgeon, an expert really in the world of plasma and how it's been used for healthcare.
Thank you, Adah. So I'm an orthopedic surgeon. I focus predominantly on sports medicine. I'm based in New York at the Hospital for Special Surgery and Weill Cornell Medical School. And I was kind of surprised by the response that people have not heard about plasma therapy. I would guess that many of you may have had PRP or platelet-rich plasma. It's something we use every day in our offices in orthopedics, and it's not just orthopedics, it's dermatologists for hair loss. I missed that boat, obviously. and it's been used for the last 15 to 20 years. And prior to it being available in the United States, athletes like Kobe Bryant would travel to Dusseldorf or the Cayman Islands to get those treatments. So let's just talk briefly about injections, and I'll be fast because of the time. When you have a problem, we have 4 pathologies that we treat in orthopedics: muscle strains, like a hamstring injury, ligament problems, ligament sprains. So we've got muscle strains, ligament sprains, we've got osteoarthritis, and we've got degenerative tendons. It's called tendinosis. We tend to use a colloquial term, tendinitis. It's actually degeneration that occurs in the middle decades. So my population of patients is on the traumatic side. You blow out your knee on a sport or you dislocate your shoulder. And then on the more degenerative side, where you've got middle-aged patients in their 40s to 60s who develop rotator cuff tears. So there are 2 constellations there. And we use platelet-rich plasma on a regular basis for hamstring injuries, low-grade ligament sprains that don't require surgery, tendinosis for degenerative changes in the rotator cuff, and osteoarthritis. And the data is very compelling if you compare corticosteroids to so-called gel shots or viscosupplementation to PRP. PRP is much more effective for those pathologies. There are other biologics which we haven't talked about, which include adipose tissue or bone marrow aspiration. Of those three options, blood, bone, and adipose, bone and adipose have more morbidity with respect to harvesting them. So platelet-rich plasma has been a big staple for our athletic and degenerative population in orthopedics. But really, we're here to talk about plasmapheresis. And I'm going to turn it back over to Adah, because that's a different type of treatment or therapy.
Yeah, well, then one of the reasons we wanted to have this panel is plasma exchange therapy, as it's also known, is almost like the diamond in the dirt of longevity, if I will. And I'll leave it up to Dr. Oz, probably is the best person to explain it to the layman.
Well, you're kind to say that. You just shared some papers with us, and some of this data I wasn't even aware of. That's how quickly it's moving. But I'll summarize it very succinctly. If you have autoimmune problems, if you have oncologic issues, cancers, if you have worries about Alzheimer's, there are therapies now that are out there. Even interestingly, there's data on behavioral issues in children, including autism. And Prince Saud, please stand for a second, Prince Saud. He's president of the Autism Society of Saudi Arabia. Prince Saud has made his life from, but these are therapies now that even far-reaching from autism to Alzheimer's could play a role. The real question is, why does it work? And there's a crosstalk that happens in your fluid of the blood, not the red cells, but the watery part, which is 45% of your blood is water, plasma. And inside of that, there are all kinds of cells. And there tends to be a shift as we get older from one kind of cell, lymphocytes, to myelopoietic cells, which are different cells from the bone marrow. And that shift comes along with a lot of chemical changes that tends to be very difficult for the body to cope with. It is why giving, and it's been known for a while, giving young blood to old people, old animals, makes them look young and feel younger. It turns out that there seems to be some opportunity to do that much easier for us, because we put a needle in one arm, draw the blood out, clean the blood, take the fluid off, add back albumin, or maybe other materials, and then put it back in, and that plasma exchange, therapeutic exchange, could be valuable. But here's the rub. Because it's so new, there's a lot of opportunities to trick people, to be dishonest. And by doing that, you hurt the whole field. So when folks who don't know much about the area start doing experiments without telling you they're experiments, we actually can hold back the opportunity. But I think right now, today, we're going to see a massive increase in therapeutic plasma exchange in order to address some of these otherwise difficult to address issues. By the way, long COVID, which is becoming more common, fibromyalgia, a lot of conditions, chronic fatigue syndrome, are argued to maybe benefit. But the devil's in the details. But the early data is very compelling.
Yeah, thank you. So one of the reasons why I think we're at an inflection point today with plasma therapy and why it's really the time to talk about it for longevity is, of course, gene editing, right, with CRISPR. Now we have it precise. With AI, of course, this year won the Nobel Prize. Massive, earth-shattering, disruptive, that we can now, what took up my colleagues in biochemistry and molecular biology 20 years to figure out a protein structure. They'll figure it out in 1 year. So with AI, we can take proteomics and metabolomics data from our blood, analyze it with AI in nanoseconds, if you will, right? We can take gene editing, understanding what genes to change. And now I believe is the time to look at blood and blood proteins with these tools to completely revolutionize how we manage disease before it ever occurs, and to monitor the progress of what we're doing, whether it's working or not, through blood work, through plasma therapy. And just to cap on what Dr. Oz said, plasma exchange really is almost like oil change for your car. And it's been used actually for decades with people that have it's like dialysis, when you do kidney dialysis, same thing. But now we're finding that it works really well, the latest data, even for people in their middle age, my age, and in their 60s and 70s. Actually, far more, works far better for folks in their middle age. And that kind of explains why, there's a lot of wizardry involved, or people think it's wizardry with PRP, if you've heard of it. I'm sure, I should have started with PRP because it's famous for dermatology and joints. But one of the reasons why you sometimes think it works and sometimes not is because it actually works better when you're younger, when you have those good proteins versus the bad proteins in your blood that your body's having a hard time as you age to excrete and get rid of. And so I think this is an opportune time to bring plasma exchange therapy and plasma therapy to the forefront, because we have these tools to analyze such complex information about the proteins and the metabolomics in your blood and what that means to your health. So with the last few minutes of the panel, I want to allow Dr. Cordasco and Dr. Oz sort of to summarize and give a pitch of what we think is important for the investors in the room in terms of plasma therapy, and also to answer the question again, plasma therapy innovations, how will they improve health outcomes? With you, Dr. Cordasco.
Thank you, Adah. So I think everybody in the room has a personal aspiration to live a long, healthy life. The reason this issue is critically important for the planet and for humanity is because, as we know, we've been told earlier this week that the Global South has the highest youth population compared to the North and the West. Well, the flip side is, by 2040, they'll have 5 times more people over the age of 40. We have to come to grips with that, and we have to make sure that we do everything we can for the Global South, for all of humanity, to extend a healthy life. And right now, Dr. Oz is a former cardiothoracic surgeon. He dealt with chronic comorbidities in medical care for many years of his career. We want to try and change that dynamic. And this is one of many options, but an important one that I'm just learning about. We're not using it clinically in the United States from an orthopedic standpoint on a regular basis. As Dr. Oz mentioned, there are some startups, some companies that are using it, but we don't really have good regulatory control or understanding about what they're doing. So I think further research is important, but it's very, very promising for all the reasons that were mentioned.
If I could just take it back maybe to the FII element, which is the future investment element. So if we're going to invest and you look for initiatives to invest, I think this is a great one. And I say it for a couple of reasons. One, I 100% believe there will be some indications that are really strong. So there's going to be a business in doing therapeutic plasma exchange. There's going to be a lot of advances made. So that gives you an opportunity to differentiate your business and build a moat around it. I think there's a strong chance to collaborate with young, new endeavors overseas, but also with the strong academic traditions here in Saudi Arabia that would allow Saudi maybe to become a leader in this space. Right now, 70% of the plasma harvested on the planet is harvested in the United States. 70%. That means everyone else is not really there yet. So you get to be the first mover, which is a major advantage. You get to get some space to grow. The field itself is young, so you'll be a mover and a shaker just because of that. And you have the opportunity to do something that is seismic. It's not a small thing to be able to dramatically change the natural aging process by rebooting the system, which is how I think about it. It's like when your computer or your phone's not working, what do? You turn it off. And when you turn it back on again, it usually works. So it'll allow us to take this myriad of illnesses that we've touched on, Alzheimer's being the one that's most intriguing to me, back to autism, Purcell's group, we look at this, and everything in between, oncologic, autoimmune, infectious, unknown ailments, chronic fatigue, COVID, prolonged COVID. These are things we don't understand even. So maybe you just turn it off, turn it back on again, and it works. And that's where I think the real opportunity is with therapeutic plasma exchange. So I'm hoping somebody in this room might think about this as a business opportunity here in the kingdom. And although none of us are, you're not involved. Are you involved in a company in the U.S.? Maybe?
On plasma therapy?
Yes.
No, not yet.
All right, so not yet. So none of us are doing it yet, but there are people who are doing it that should not be hard for you to find and partner up with, and it's worth the investment of intellectual effort to figure out if there's an opportunity here in the kingdom.
100%. And I just want to second what Dr. Oz said. I think one of the reasons that I wanted to hold this panel and talk about this is, a country like the Kingdom of Saudi Arabia, we want to do something really well and be known for it. And currently, there's absolutely no clinical trials in studying this. There was never really a large-scale clinical trial to study PRP. And there are economic reasons for it. But being that the Kingdom of Saudi Arabia does have the human longevity effort with evolution and such, and there are a lot of people in the kingdom and in the Gulf region that go out to certain countries looking for stem cell therapy, plasma therapy, unexplored therapies. We could have the world's largest scale clinical trial or study in the kingdom that will then allow this to be the mecca, if you will, of plasma therapy for longevity. It's an opportunity because of, again, the platforms that are available to us in terms of artificial intelligence, gene editing, proteomics, and metabolomics. So it's an opportune time, and it's a perfect storm for an investor to take advantage of this moment in time for this field, plasma therapy.
Ada, one last comment as it
Yeah, go
relates
ahead.
to the kingdom. I think everyone in the room is aware of the emphasis on sports here in the kingdom, and this is a perfect opportunity to really establish a therapy that's useful in getting athletes potentially back more quickly after injury, but more importantly, preventing the injuries in the first place. And combined with AI, it's a very promising process.
Absolutely. If you're an elite athlete, someone who's trying to be preventative, this is what really clinicians and investors should be looking at. So with that, I want to thank you, the audience, for giving us a chance to talk about this.
Read
Thank
her
you very
monograph.
much.
It's excellent.
Yeah, please read this when you're bored in one of the FII cars.
We need a photo?